By 2 to 3 days, the cord actually starts to become dry, and by 6 to 12 days, it's normally fallen off and you'll find it in the nappy somewhere. For a period of about 7 to 10 days after it's fallen off, you still have to be quite careful of it with regards to infection. Your baby won't feel any pain from the cord itself because there's no nerve endings in the cord. So when the cord's actually cut at the time of delivery, the baby doesn't feel this at all. Sometimes parents are concerned when or if they need to clean the base of the cord with a wet cotton wool ball that it causes their baby pain. It doesn't. It's often the wetness of the cotton wool that actually makes the baby startle. The cord does fall off in one piece, and you will often find it in the nappy when you're changing the nappy, so don't be startled. At the time of separation, when the cord actually drops off, there is some slight bleeding at the base of the cord. It's not excessive and it's nothing to be concerned about. After the cord falls off, it normally takes between 7 to 10 days for your baby's belly button to actually heal. During this time period, it's very important you keep the area free from infection. It's not recommended that the cord be cleaned routinely, just if it needs it, and by that I mean if the cord is covered in poo or if it becomes infected. It's quite important to ensure that the cord, when it's drying, doesn't rub against your baby's skin on the stomach, because the skin on the stomach is very delicate. Now, one of the ways you can prevent this is by encouraging or making sure your baby wears baggy vests and baby grows, allowing the air to circulate around the cord. Avoid the tight-fitting baby grows and vests, as this will make the cord sweat and can encourage infection. The main things that lead to the cord becoming infected is if the cord is in a moist environment, which can encourage infection, and also if it's not kept exposed to the air. The umbilical cords of little girls and little boys require exactly the same care and treatment. The only difference is that because the little boys have a penis, they need to make sure when you're putting the nappy on that the penis is pointing down so that the baby's not going to wee up into the cord, encouraging infection. Routine cleaning of the cord isn't recommended. However, there are certain circumstances when you would clean the cord, and these include if the cord's covered in lots of urine or obviously poo. So it's quite important that you make sure that you clean this quite gently with some wet cotton wool balls to ensure that they're clean and it's clean, and then leave it exposed to the air. There's 4 main signs of the cord becoming infected. These include redness around the base of the cord, a discharge from the cord, also an odour and some bleeding which occurs from the cord base. Now, bleeding also occurs at the time of separation of the cord, so it's not something to be concerned about at that point. It's also very important if your child is showing any signs of a fever or being generally unwell that you seek medical advice immediately.